شكور صدق الله العظيم.
Bismillahirrahmanirrahim. දිවරාජ්‍යයේ රයිස් ජම්හූරියාගේ නායබ ෆයිසල් නසීම්, දුනියක් සිඛ ජමියාගේ දෙකණු ඉරිමති ඒෂියාගේ රීජනල් ඩිරෙක්ටර් ડોક્ટર પૂનમ કત્રપાલ સિંહ, મિનિસ્ટર ઓફ હેલ્થ અબ્દુલ્લા અમીન, કેબિનેટ મિનિસ્ટર એમ્બેસેડર અલિફતાવගේ જમિયા તકુගේ રાજ્યન કડાળુ વફવા મંદૂબો એમ્હા હાજરીન અસ્સલામુ અલૈકુમ વરહમતુલ્લાહી વબરકાતુહ.
Your Excellency Vice President of Maldives Faisal Naseem, WHO Regional Director for Southeast Asia Dr. Poonam Ketrapal Singh, Minister of Health Abdullah Amin, Cabinet Ministers, Ambassadors, UN agency representatives, invitees, ladies and gentlemen, Assalamu alaikum and a very good morning.
අද මියදකි ආමසිකතු ඉතුරුගේ කාමියාබිය දිවරාජ්‍යයේ හාසිල් කරවේදුවේ මේ දිවරාජ්‍යයේ සිහි දාරාගා ෆා කොල්ලවේ තාරිහි දුවේ අද දිවරාජ්‍යයේ මෑමිහාගේ ෆරාතුන් කොඩ දරිෆුල HIV අදි සිෆිලිස් වාසෙනුවා ගවමින් කමුගා දුනියක් සිහ ජමියායන් කණ්ඩවලමුගේ රස්මියාද තිය හුරියා බේෆලුන්න මරහබා දන්නවා.
We welcome you all to a historic day in the health sector of the Maldives, a day that marks the achievement of another public health milestone. Today, together, we will mark the elimination of mother-to-child transmission of HIV and syphilis in Maldives.
Biresmiyat fashmugutum kiyawa vidalwi Amnet Zaina ada den kuriyangoti Minister of Health ge wahak ful dekko.
We began with Quran recitation by Amnet Zaina. Next, we would like to invite Minister of Health to give his remarks. Minister of Health Abdullah Amin.
Bismillahirrahmanirrahim. His Excellency Vice President Honorable Faisal Naseem, WHO's Regional Director of South Asia Dr. Poonam Ketrapal Singh, Cabinet Ministers, representatives from other UN agencies and international organizations, members of diplomatic community, senior officials from government and state institutions, members of National Validation Committee and National Validation Team, representatives from the civil society and the media, all my colleagues from health sector, ladies and gentlemen, Assalamu alaikum. This is a momentous occasion, a proud moment for Maldives and particularly to the health sector. Today we are yet again celebrating an important public health achievement: elimination of mother-to-child transmission of HIV and syphilis in Maldives, the second country to do so in this region. And this is indeed a milestone achievement and adds to the long list of disease eliminations and public health achievements for Maldives in recent years. Dear colleagues and partners, in the excitement of celebrations, we sometimes tend to overlook the significance of the context and how we have come this far. Obviously, EMTCT has not been achieved overnight, and indeed it's the fruitful culmination. Many years of diligent and sustained hard work on the part of our dedicated healthcare professionals and healthcare provider institutions, aided by cohesive policies and investments. Despite the challenge of geography, remoteness, and having to travel rough seas, expecting mothers and their families give utmost importance to seek the necessary healthcare, testing and follow-up visits at hospitals. It shows the level of healthcare literacy and awareness among the population and the close linkages the health facilities and healthcare workers maintain with communities. Establishing health infrastructure on tiny islands with small communities, organizing the necessary human resource is a costly affair. Yet the government of Maldives has strived to invest in establishing testing and screening facilities, recruiting doctors and nurses so that the expecting mothers can obtain the necessary services at facility close to home. Maldives has one of the highest per capita expenditure on health, reaching about 10% of GDP. Successive governments have put in place policies around universal health coverage that enables patient transfers, outreach programs, curative services that are covered under social health insurance, aimed at reducing out-of-pocket payments and catastrophic financial burdens on family. And most importantly, promoting a health-seeking behavior and individual responsibility. Our healthcare workers and allied health professionals are doing a tremendous job in ensuring that all pregnancies are recorded, regular ANC visits are coordinated, all required tests and screening are done, and the records are properly maintained and compiled. Without these interventions and dedication by healthcare professionals, we would not have reached this target. Through international cooperation, including UN and other multilateral organizations, collaboration with other countries, and of course, with technical guidance of our closest associates in global health, WHO and UNICEF, we have been able to establish and maintain robust public health programs, especially in the areas of sexual and reproductive health and family planning. It is not just one factor, one intervention or a combination thereof, but rather cohesive system-wide interventions and innovations that are well coordinated that make the difference. Achieving EMTC certification today goes beyond this very joyous event. It underlines the Maldives has a robust and mature health system. Madam Regional Director, let me take a moment of applaud and appreciate the continuous support and guidance from WHO's regional and country offices that have been a critical element in all our public health interventions and achievements. WHO's collaboration in the health sector of Maldives indeed is a shining example of partnership and cooperation. Dear partners and colleagues, now that we have achieved this important milestone, one key message I want to give is that we should not rest on our laurels, and we certainly cannot afford to be complacent. It was sheer hard work and dedication that we have reached the elimination status. It would require all of us to work even harder and show even greater dedication to maintain the elimination status. We should take the recommendations and outcomes on the validation process forward and ensure that all measures are in place as recommended to further strengthen the health system with the overarching goal of achieving greater health and well-being for all Maldivians. The government is fully committed to delivering its health sector pledges as priority. We are now in the process of connecting all government health facilities through a network. Ambulatory services are being improved. As part of health information system strengthening, DHIS2 will be rolled out. Transportation systems throughout the country are being revamped to increase connectivity and efficiency. These interventions will no doubt further enhance the system, disease surveillance, and timely preventive and curative services. My second message is around the saying, prevention is better than cure. Now that we have put in place systems that measures to ensure that no child would contract HIV or syphilis through birth, we should not forget about the many other disease prevention interventions. Indeed, it's the world's happiest moment when a healthy child is born to a healthy mother. Now, keeping that child healthy would require that the child is given the necessary disease prevention vaccines. It is exclusive breastfed for 6 months and provided with proper nutrition and care to grow into a healthy adult. ladies and gentlemen, we are talking here today about protecting our children from diseases and making sure they are born healthy, they grow healthier, and stay healthy. This requires a holistic approach. Ensuring your child is healthy requires interventions before conception, during pregnancy, at delivery, and even after the child is born. These interventions are multi-pronged and multi-level and multi-dimensional. Therefore, they have to be responsibility for everyone involved: mothers, fathers, family, community, institutions, and the broader health system. All have their roles and responsibilities. In conclusion, I wish to congratulate everyone involved for this remarkable achievement and thank in general everyone or institutions that contributed in Maldives achieving EMTC status. Let us continue working together not only to maintain EMTC status but also achieve other similar disease elimination and public health targets. Every child is precious. Every child must be born healthy. Everyone has a role to play. Thank you. Wassalamu alaikum.
Thank you, Minister Amin. As you mentioned, it is the dedicated efforts of our health professionals and institutions which have made today's certification possible.
Shukriya, Minister Amin. Minister Gawafluga Fahakura Vifadai, Miad Mihasa Kuron Kamiabiyaki, Sikhi Daira Gavara Gina Fundwaringe, Vara Gina Dohuga Masakatum Hasa Kuravun Natijae. Ada Den Kuriamati, Duniak Sikh Jamiaga Dekonurimati, Asiaga Regional Director, Gawafudeko.
Now I would like to invite the WHO Regional Director for Southeast Asia, Dr. Poonam Khetrapal Singh, to address this gathering. Dr. Poonam Khetrapal Singh.
Your Excellency, Honorable Faisal Naseem, Vice President of the Republic of Maldives, His Excellency Abdullah Amin, distinguished Cabinet Ministers, members of the National Validation Committee, members of the Diplomatic Corps, WHO colleagues, distinguished guests. A very good morning to you. It is a pleasure and a privilege to be in Maldives once again, and again to celebrate another public health achievement of this country. That achievement is the dual elimination of mother-to-child transmission of HIV and syphilis, which you find written all over, and which the Honorable Minister just referred to. Maldives is now among the first countries in the world to create a generation free of mother-to-child transmission of both diseases. Your remarkable feat reflects the wisdom of the country's policymakers, the excellence of its program managers, and the hard work and determination of the health workers. It also reflects Maldives' broader trajectory. In recent years, you have been certified malaria-free, you have eliminated lymphatic filariasis and measles, and you have controlled rubella. You can be proud of these achievements. Each one is an outcome of years of struggle, backed by years of commitment, which you've heard about. As you know, Maldives initiated measures against HIV/AIDS 4 years before the first case was even diagnosed in 1991. WHO is proud to have supported you to do this, alongside partners such as UNDP, UNICEF, and UNFPA. Importantly, the program's emphasis was always on inclusivity and integration. You worked over many years to create awareness of HIV and syphilis generally, especially among at-risk populations. You worked over many years to ensure services for testing, for treatment, and for counseling, which were readily accessible to all, regardless of demographics. And you worked over many years to integrate key preventive interventions across services, whether for safe blood transfusion or for injection safety. The outcome of this approach and commitment was the low transmission of both diseases, which helped facilitate today's celebration. It is no coincidence that the values your long-term program reflects, which is inclusivity and integration, are the values at the fore of public health more generally today. Indeed, they are values that are central to our quest to achieve universal health coverage. I commend you on your visionary thinking. I also commend WHO country office colleagues for the technical and operational support that they have provided. Their efforts have borne fruit. In acknowledging the significance of today's celebration, however, I would like to emphasize the importance of maintaining it and of preventing new infections among all age groups across the islands. And I thank the Honorable Minister for already raising this point very emphatically. To this end, the key principles of UHC are crucial. Not only will they help you maintain your achievement, they will also help sustain and accelerate progress against mother-to-child transmission of HIV and syphilis across the region more generally. In pursuing these outcomes, 3 areas of action should be our focus. First is the need to maintain or establish high coverage and uptake of antenatal services by ensuring that all pregnant women can and do access antenatal care. All pregnant women are more likely to be screened for diseases and be provided appropriate treatment. Health workers must be encouraged to make this happen. Second is the value of further integrating health services. As Maldives has demonstrated, integrated services really are the way to fill service gaps and ensure that all patients at all levels of care are provided the services they need. Integrated services also increases equity and helps ensure the right to health is respected, it is protected, and it is fulfilled. And third is the need to extend people-centered services, coverage to all vulnerable groups, including migrants. When it comes to disease transmission, our shared biology has no correlation to visa category or otherwise. As such, we must work even harder to accelerate progress towards UHC and to secure access to health services for migrants and all vulnerable groups everywhere. Your Excellency, distinguished guests, as you appreciate, honing in on each area of action will have many benefits beyond maintaining of accelerating progress towards EMCT and of HIV and syphilis. These range from helping prevent maternal and newborn mortality to controlling rubella or hepatitis. The importance of pursuing each one cannot be emphasized enough. Given your achievements, I'm certain you will do precisely that, and you will continue to go from strength to strength, including in your efforts to eliminate hepatitis as a public health threat and to continue to make rapid and lasting gains against leprosy. Indeed, as I stated at the outset, Maldives has achieved a lot. WHO looks forward to supporting you achieve even more. On that note, I once again express my heartfelt congratulations to Your Excellency, the Honorable Vice President, and to the Minister of Health. You can be truly proud. I also commend the many frontline workers who have toiled relentlessly, often in remote and hard-to-reach areas, to achieve this outcome, and to the people of Maldives for their commitment to making further progress in public health. I wish you joyful celebrations and encourage you to continue your forward trajectory even faster and even stronger for the health of all people everywhere across this remarkable country. Thank you.
We appreciate and applaud your leadership in the region to have countries achieve elimination status for many communicable diseases.
शुक्रिया डॉक्टर पूनम सिंह मिसराद गांव तक गाइन गाइन आरा बनिता नतालमुगा होदे फेवा कामयाबी तक की कमनाग इसनगोमा हासिल करे फेवा कामयाबी तक की फाह कुरन देंगमती मिरस्मियातु के एम मुहिम नंबर आदे दिवे राज्य की मैमीहा के फरातन दारिफुल HIV अद सिफिलिस वासिनुआ गांव में कमगा खंडाला एकमुगे लियुं हवा कुरन.
Now we have come to the most anticipated part of today's event, the handing over of certification for having eliminated mother-to-child transmission of HIV and syphilis in Maldives. May I invite the Regional Director, Dr. Poonam Khetrapal Singh, on stage to hand over the certification. And may I respectfully request His Excellency, the Vice President of Maldives, Faisal Naseem, to come on stage to receive the certification on behalf of Maldives and to address this gathering afterwards. Thank you.
देंगमती नाब्रेस के वाकफ देखो.
Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Minister of Health, Afad Abdul Amin. दुनिया की सेहत जमिया देखो इरुमती एशिया सरहद कंडाल वफा हुन्नवा रीजनल डायरेक्टर डॉक्टर पूनम केत्रपाल सिंह दादुत के वजीरों दिव्य राज्य के हुन्नवा दुनिया के सेहत जमिया के रिप्रेजेंटेटिव डॉक्टर अरविंद माथुर दिव्य राज्य कंडाल वफा एम्बेसडरों मी हफ्ला वाडन ती बेबी मिहा बेफ्लों अस्सलाम वालेकुम व रहमतुल्लाहि वबरकातुहू. आदेव शक्कन्ने अवुन मिना एव्वेस कामे हासिल में कुरेवेनी कामयाब अवुन मिना मी लिबिगेंदनी वारा गिना बायगे मीने मसकतो ए एव्वेस हालेगा एम्मे बायको वाकी बायको कुरा मसकता कुं हासिल कुरेवे कामिन्नु ए मियादु अवुन मिना मी कंता हासिल वगेन दियैरु एम्मे मुहिमु कम्मेगे गोतुगा मी दायरागा मसकुरवी हुरिहा फरातकेगे मतिं आदे एतके दुवसके वंदें वरा दति उंदगु कम मतिगेस मसकुरवी एम्मेहा फरातगु मतिं अवुन में handanko e farattaka awun men shukuru dannon je ade hama yayko evves kame hasil bumun kamiyab bumun awun menge emme muhimmu kamege gotuga den balan jeheni e kame demehettu mattaka awun men hasil kurave kamege matiga nuwata e kama awun men hamaykani fakhru veri wegen tibumakun e kantatta demehittene kamakan nuwan he miyadu awun mege sihi dairaga wakin khassako masakkurabba emmeha farattakum wes itura azum warugada kuran jeheni ay sarkargo muwassa taka eheni hen emmeha farattakum wes azum kandalan jeheni mi libunu kamyab awun men damahatta ituru masakattake kuruma ade mikantata wegen awun menam mi sharaf miyadu divirajyege raitunna libigen diero awun men handan kollange ba jehe haqiqataki divirajyege rattahuga warad dati haluga warag gada kanduga kuda kuda doni faharuga mi kantatta hasil kurumattaka mi landu naritaka hame diumattaka raitun ade sihat salamatun tibe bayka nuwata rangalu sihhate hodumattaka masakattake koffawani awun men hama mi kantatta handan kurange ba jehe mi huriha gonjehun tahaka ekkovves edrafun anirasha daturuko adi mi male gina duwassake wanden awun mena fenigen diyei sihi kitamme kudakamegaves rajyage ki hisab takum akin khassako balive inneiru e undagu duwassahugaves datur kuran jehunu manzar ehem bima miyadu awun men eba jehe haqiqatu wes e farata mikamuga shukuru ada kura ada awun miga wakin khassako sihi dairaga masakkuraba farattaka dannawadan oti adi awun mege siyasat kandaluba farattakum visanjehe kamaki hedi fahunna usul thaki ei awun men abadu wes itura nagalu kurumattaka badal kuranje kantattake ada awun mege sihi dairaga befulun adi divi sarkaruge eki befulun warak ginaginan divi rajyege rattaka eba awun men datur kuram awun menge maqsattake ve awun bala hodam benu ba kantattake hure awun menam min komme daturakum ves mi masakatuge terein awun menam mi public engagement uge terein abadu ves fenigende hunna usul tahuge sawbun dimawe hunna datita ade evedana war kudi kantattaka ehnamas gina bayaka ekamakun datikame kurimati kurwa kama wanya ei awun men badal kuran jehene kantatta e awun miyadu wakin khassako health minister ves dannawadan oti migotan huri kantatta awun men hoda bada divi sarkarun ade divi rajyege raisu jumhuriyage emme bodu e wawdege gotuga emme bodu samalu kame miyoti am sihat rangalu kuru dulehev hashihev sihategga raitun tibun ei divi rajyege raisu jumhuriya muli divi sarkarun ves emme iskame dekan yagin wegen dani divi dawlatum miyadu ekamattaka kura heda budgetuga jahafunna figayen ekani wes awunu mena ekan egigen bade ehem wima awunu men eya evvara e masaka ko rajyege raitunna kuriha hisab tahega komme rahegga hunna raitakavves e faseha kama awunu men miyadu midakka wahaka mikan kamyab kam matiga devu mattaka kuran jehena masakattan awunu men medu kendumen neti awunu men ekanta kuran jehen ade awunu men na abaduwes tafaateki am sihhata gule gina kantattahuge kamboduwun gina kantattahuge wahakata abaduwes rajyege eki hisabak takun adi mi mali investe kemunde awunu gabu kurani mi awunu men huriha emmenge wes dimmae awunu men salamatun tibumattaka ekuga masaka kurun ebbayge gotuga abaduwes kurane kitamme gina guna masakattaken hunnan awunu men fasehatake awunu mena ekkolon libigen dairu awunu mena itura kuran jehene kantattaken hunnan ade miyadu gawmuga diriti uleniki hamaykani awunu menge hamaykani divihira yitun nebestun ade beru mihum ves ade wakin khassako awunu menge taraggiga mashruutahuga wara gina adadaka beru mihum zirule munde ehme aamus hatamedu awunumen visnairu awunumenge salamata sha e hurihayemmege salamata rakkatir kamattaka gina guna kantattake kurange baje awun hami fursatuga dairaga masakurabba farattaka adi wakin khasako school tere imbes gina guna kantattake kuruma ikan mang ede wahaka emmeha farattaka awundu dannawala ade eve shakkenne awun mena miyadu mihisaban adewunu iru awun men qabul kurange baje awun mena medu kandumen neti libem anna ehi terikama eki goggoton libem anna ebbalu. I would like to thank Madam Doctor for the continuous support that you have been given from WHO, and also we have been there has been great engagement with Dr. Arvind Mathur for the last many years. I think today's success is a result of efforts by the whole public, and this goes to the public. Once again, thank you very much. Awunuge huriha sedumaki, awunuge duaki, awunu menna furihama sihatega demi tibumataka, itoro masakattake ko rajyege ki kankoltauga diriule farattaka awunu men mi hidumatta abadus forko dinumattaka ginaguna masakattake vegen diun. Ade awunu men emme kura masakatuga Allah subhanahu wa ta'ala baraka lavashi dive rajyege emme ha raitunna fagati duwasake minbar kuravashi. Wassalamu alaikum wa rahmatullahi wa barakatuh.
शुक्रिया रईस जमहूरिया के नायब फैसल नसीम। मियद मिफाह कुरा कामयाबी यकी वर गिनद वस्तु के मसके मावड एमएन सिकी हिदमत फोर्क दिनुमा HIV आदि सिफिलिस टेस्ट कुनु फेशी एम फुरतम एम फाहुंगे दिरासा तका टेक्निकल मालूमात गलीगा हिदमत तरगी कुरा मुंदिया मियद मी फेनिगेंदणी रयतुंगे हग्गु तका बेणुन तका रियायको फेमवर रंगल हिदम मुಳಿ राज्य घोरिया हिसाबकु गायम को हेलुन तेरी मुजितम बिना को मुगे नतीजा आदे मिहा हिसाबु मिगेनस्तेनी मी दतुरा बे कुरु वीडियो ए.
Ladies and gentlemen, the road to today's certification has been a long one. It began with universal antenatal care and offering testing for HIV and syphilis to all pregnant women. It has continued through the years, being expanded to all the regions of the country and continually strengthened and updated according to the latest technical guidance. It is the culmination of quality care expanded to the entire population with a strong belief in education and the rights of the people. Let us now view the journey which brought us here today.
Human immunodeficiency virus, HIV, continues to be a major public health issue globally, having claimed more than 35 million lives so far. HIV/AIDS has devastated families and countries. There were approximately 36.9 million people living with HIV in the world, with 1.8 million people becoming newly infected globally. Mother-to-child transmission of HIV account for 9% of new infections, and congenital syphilis is the second leading cause of preventable stillbirths. Maldives Public Health started efforts 4 years before the first case was even diagnosed in 1991. The program created greater awareness of HIV/AIDS and syphilis in general population and among at-risk populations specifically. The services for testing, treatment, and counseling were readily accessible and available to everyone across the island country. The key preventive measures were integrated across services, whether for safe blood transfusion or injection safety.
Maldives has made notable gain in the area of public health over the years. This is largely as a result of political commitment.
The National Strategic Plan for the Prevention and Control of HIV/AIDS guided efforts to maintain low prevalence, and outlined its target for elimination of mother-to-child transmission of HIV/AIDS and syphilis as an important public health milestone, reflecting effective and equitable national policies and services that place people first. An inclusive approach with integrated health services and quality reproductive health services ensured high coverage and uptake of antenatal care, including screening for HIV and syphilis for all pregnant mothers. Such an approach resulted in low transmission of both diseases and prepared the program to seek validation of their efforts for elimination of mother-to-child transmission of HIV/AIDS and syphilis. A National Validation Committee and National Validation Team for EMTCT, established by the Ministry of Health, assessed areas of programs, data management, laboratory, equity and human rights, and shared its recommendations with the Regional Validation Committee consisting of WHO, UNICEF, UNAIDS, and UNFPA. Regional Director of WHO Southeast Asia established a regional validation team consisting of independent experts that reviewed the progress during their mission in September 2018 through extensive mix of meetings with national counterparts, visits to institutions, atoll visits, meetings with NGOs, and interactions with people living with HIV, and recommended favorably to Global Validation Committee, which conveyed its decision to WHO DG of validating Maldives for achieving the elimination of mother-to-child transmission of HIV/AIDS and syphilis. Maldives is now among the first countries in the world to create a generation free of both diseases. It reasserts itself not only in maintaining the achievement, but also to prevent new infections among all age groups across the islands.
Today, while we rejoice the success of achieving this status of mother-to-child elimination of HIV and syphilis, we are committed to the challenge of sustaining it with stronger system of prevention and care. I extend my sincere gratitude to those who worked tirelessly to achieve this success.
We look forward to closer and continuing collaboration with Ministry of Health and partners to sustain these gains and to have generations free of these diseases.
ade miyadu mi libun sharfaay algon menge maseke nimuni kino mi kamyabi demhettumaki warabura masakade miyadu ge rasmiyat nimalani mayen allah ge waqfulaay a hivwaraayko mi sharaf demhettuma atukuriolalamu maabadu mi hunna rakkateri femwarnagol sikhi hidmay for ko dinmasha tuttu kudinna duleyo mustaqbale kashawar ko dinuma azum kandalamu.
Today does not mark the end. There's a lot of work ahead to sustain this elimination status. We conclude today's proceedings with renewed energy and commitment to ensure safe and quality care to all pregnant women and to secure a healthy, prosperous future for our precious children.
Mirasmiyatu bayar wadanne vitiwe emha befrunna shukr dannawan huriya befrunna bajjori duhakeden wassalamu alaikum.
Thank you, Your Excellencies, ladies and gentlemen. Assalamu alaikum and wish you all a great day ahead.